My name is Fleisher. I'm the Robert D. Dripps Professor and Chair of the Department of Anesthesiology at the University of Pennsylvania. I'm from Philadelphia, went to the University of Pennsylvania as an undergrad, then to Stony Brook for medical school. Although I started in surgery, I quickly decided to switch to anesthesiology after 1 year and actually did my residency at Yale University. Was on the faculty there for about 14 months before, because of love and marrying a woman from Baltimore, I moved to Baltimore and was a faculty at Johns Hopkins, where I actually rose to be vice chair there, and in 2004 came to Penn as the chair. So a number of my books have been out for a while, and we're actually on newer editions. So what I'm most excited about is two books. One is Essence of Anesthesia Practice. That actually was first done with Michael Roizen in the about 1996. We just came out with the third edition in the last year. What's exciting is we actually have accompanying apps that were available through the iTunes store, and they really did a phenomenal job. The book is created to actually be about a 5-minute, 10-minute quick consultation on key drugs, key diseases, key procedures, key alternative medications, with what are the risks. One of the favorite sections are what to worry about, a table that really talks about a systems-based evaluation approach, and then the perioperative implications. And it's all templated so that every chapter is very similar. And now we actually have divided those 4 sections up into 4 different apps so that you could have the book itself as a reference, but if one particular type of app is useful, it fits very nicely on your iPhone or iPad, and I've even used it in the OR, both to look up diseases that I may not remember all the details about, or to use as a teaching tool to show my residents what they can actually, a systems-based approach and how to think about it. For those residents who are actually taking the boards, it's the ideal study guide to really get you ready for that, for the anticipated problems, which I think is a key issue. We just heard a talk from Atul Gawande talking about what you should say in a preoperative checklist. Well, with certain diseases, that preoperative checklist could include key worry about, key anticipated problems because of their diseases. And this app, this book, is a great way to actually know those answers ahead of time. So the other book, we've actually had 2 editions of what I call evidence-based practice of anesthesiology. When I came up and proposed this to Elsevier, it was interesting because the concept of evidence-based usually is meta-analysis, and it's usually a much more rigorous and sort of systematic review. In my mind, and this is related to actually a New England Journal review I wrote, I actually approached it differently because I thought what's important is the evidence for somewhere between 70 and 90 questions, depending on the edition, that really anesthesiologists want to know what to do. But in the end, they want to know what are the areas of uncertainty. So that's in every chapter. What's missing? And I think that's very important for learners. And then the last thing is the authors make their own recommendations based upon the evidence. So by having experts write the chapters, and really if you want to stay only with the evidence, you can stay with that, but if you want to actually understand how to apply evidence, which is one of the things I'm most interested in, then that author's recommendations really says this is the pragmatic way to actually use all these evidence tables. So we did a first edition, we've now done a second edition, and again we ask what are the key open questions and has any new information become available.